looking at the entire body and looking at the entire function of the body is the right way to go, and changing people's lifestyle. And that's what we do. Our job as a coach and as a mentor is to give you the right kind of information, but more importantly, the right kind of plan of action. Because, the saying is, knowledge is power, but knowledge is only power if you have action to go along with it. Otherwise, it's useless. I mean, most everybody agrees with me with that. So that's why we put a really simple plan together that anybody can use. I mean, we have single moms, single dads, disabled people, people on fixed incomes, retirees who are able to follow our programs and be able to afford our programs to get the health they need and to take back their life. Because in Latin, doctor means teacher, to educate your patients. So I've always been a firm believer that if we teach our patients the right way to live, that they will have a much better chance for a quality of life, instead of dying from some chronic illness or disease. And so more medication is not the answer. And I hope I made that clear with this part. Doing the right kind of test is really important. So whether it's your cortisol, your hormones, your gut health, or even getting the right test when it comes to blood testing, and also checking your all of your hormones. They all work together is my point on it. So sorry about that. Anyways, the programs that we have here, we have a 12-month program, we have a 6-month program, and we have a 3-month program. And it really depends on where you are, how sick you are, how many medications you're on, and how willing you are to make a change in your life. The program, we accept two kinds of people. We accept A players and B players. We don't accept C. And what I mean by an A and a B player, an A player is somebody that's going to play full out. They're going to change. They're going to go, if I say, hey, you know what? You got to stop eating sugar. You got to stop eating corn. You got to get these GMOs out of your body. You've got to stop eating, potatoes, onions, and tomatoes. And you've got to get the soy out. Corn is one of the most worthless things out there. They've altered it so much to where these pesticides now don't kill it, but it still absorbs into the food. And then you eat it, and all those toxins build up in your body. Our food nowadays have hormones in them, and so many people's hormones are messed up. And we want to know why people are dying early from some chronic illness or disease, because it's just all the buildup of toxins. So the other thing that we do early out is we do a detox. Doing a detox, it's amazing at the results we see. People's, if your body's working right, it doesn't store fat, so it's getting the stress under control. We're all in a state of stress from the moment we wake up to the end, because we don't know how to deal with it. And our bodies weren't designed to stay in that constant state of stress. So that really screws up our hormones. And so when we're getting and we're mentoring people, we're teaching them techniques on how to relax, how to find out if they are in stress, and recognizing that and giving them drills to get that under control, because stress is the biggest and the fastest way to put yourself in a grave. And so that's why we look a lot at stress, and we believe in the teaching and coaching and mentoring. And that's what our program's about. It's giving you your life back, but more importantly, so that you don't need us. You don't need physicians. You now have the information and the understanding of how your body works, and then when your body's not functioning right, what you need to do. So I hope this made an impact on your life. It's totally changed, the way we practice and the way we work with patients to truly get to the root causes of problems and stop treating and masking symptoms with medication. And so, and that's the micro part of it. One of my colleagues said it best, as he said that, symptoms is kind of the macro, where, it's easy to see, and we throw a lot of medication at those macro things, back pain, IBS, Hashimoto's disease, all these autoimmune diseases, throwing medications, at it. but we want to get down to the micro level, and that's what functional medicine does, and that's what we do. And so if this sounds like it's the right fit for you, it sounds like, and it resonates with you, you know what? Then we can't wait to see you and get you in the office and change your life. I think you're going to be amazed. Have a wonderful evening. Thank you so much.